Hi, I'm Sarah, nurse practitioner at Austin Labiaplasty and Vaginal Rejuvenation. I'm here with Katie. She is a patient of ours who's kind enough and brave enough to do an interview with us this morning. Tell us a little bit about her experience and pass on some of her wisdoms to women who are thinking about having labiaplasty surgery. So how did you find, I guess you knew about the surgery from hearing about it before.
I did not.
How did you learn about
labiaplasty
surgery?
I simply Googled excessive vaginal tissue. Literally, that's what I did. And of course, the first lead that came up was a labiaplasty. And I felt relief. I thought, oh, well, then I'm not the only one. And went from there.
So how long was it between learning about surgery and booking a
taking action? It was literally 48 hours.
Okay.
It was immediate. I thought, oh, I'm not the only one. Something can be done, and I will take action on this. Yeah.
So once you knew you wanted surgery, there's what the procedure is. How did you decide where to go?
I Googled Austin Labiaplasty, and I think when you're finding any business nowadays, you take one of the first entries that appears within your search engine. I used Google, and you were one of the first entries that came up.
Cool. Did you research us or the doctor, look at pictures?
I will say that there was one other business prior that's well known in the Austin area, and so I called that business and received immediately a voicemail to leave my name and callback number. And I thought, well, that's funny. It was a Monday. It's during normal business hours. So I called back. I called back a few hours later, and I left my name and number. And I thought, well, that's really odd that I'm getting prompt. It must be a mistake. And then I called the next day, and I was done. I was done pursuing that business. I then called Austin Urogynecology. And immediately on the first ring, the kindest voice answered and said, how can I help you? Such a relief. And so immediately I was drawn to your practice as opposed to the other. I completely scratched the other practice, in fact. That's how important and pivotal a human voice, human kindness answering your phone is to your patients.
That's nice to hear.
Yeah.
We have a very sweet front office. So after you called, what was it like to come in for the consultation?
Very easy. It was relatively quick. Within a week's time, I met with you. I really appreciated meeting with you, Sarah, a female, and just having a one-on-one conversation with another female. The doctor was not present, and that was actually a relief. It was nice to discuss this with a female and have any questions that I had answered, kind of in the privacy of your discretion. And I felt you offered to me during that appointment, you offered that the doctor would call me that evening if I so desired, if I had any follow-up questions. And I didn't because I felt very comfortable, but it was very, very nice to have that option. That made a great impact on me. Would you like the doctor to call you later today? So thank you for that. It was comforting.
Good. I'm glad you had a good experience.
Yes.
Had you ever talked to anyone about having surgery or the symptoms that you had before your visit here?
No, I know no one. Yeah. I know absolutely no one.
So were you nervous coming in?
I was not, because I am a health practitioner myself, and so no. I did preliminary research. I felt quite confident, and felt very comfortable in your presence.
Thank you.
Yeah.
Were you nervous about the idea of being awake for the surgery?
Yes, I was. I was nervous up until that morning. I will say that the medicine that your office prescribed, including a painkiller and an anti-anxiety medication, was significantly, in a positive way, more debilitating than I had ever expected. My father brought me to the procedure. Had no idea what I was having done, but he dropped me off. And then I took the medication after I took it actually in the bathroom, and immediately felt the results of the medication. I have very little memory of that morning. I honestly couldn't divulge any details of the procedure.
Okay.
In a very good way.
Yeah.
It immediately relieved my any anxiety, any tension. I don't even know to this day how long the actual procedure was. It felt 4 to 5 minutes.
Wow.
I mean, tell me.
It usually takes a few hours.
I would say it was. Isn't it funny? It felt like fun. Isn't it funny how just oral medications can really? Now I will say it may not have that effect on everyone. That was just my experience.
And then, so afterwards with the recovery, how was the pain control for you? Swelling? Was it more than you expected? Less? How was that for you?
Sure. Unfortunately, I had more swelling than I anticipated. My suggestion to patients considering this would be, don't try to be a hero. I thought, I'm going to get through this. I'm strong and I can take this. But about maybe 48 to 72 hours after surgery, my swelling was so intense. And again, this is just my experience. Another patient may not have the swelling that I had. I did finally cave in and contacted the office, and I saw you. And that swelling was immediately relieved with a prescription steroid.
Mm-hmm.
I wish with all my heart I would have called 2 days prior, because my gosh, I couldn't function due to the swelling, and it was so easily relieved. The pain was well controlled with the pain medication you prescribed, and thank you to your office for offering to refill. Is it enough? For constantly checking on my comfort level.
Yeah.
Although I chose not to refill the pain medication, it was nice to have that option.
Yeah. We definitely want people to have a comfortable recovery.
Sure.
One thing I did want to ask, so you mentioned that you had a lot of swelling in the beginning, more than you had anticipated.
Oh, sure.
Do you feel like that affected your final results? Can you tell that you had the swelling now that you're a couple months out?
No, absolutely not.
Yeah.
No, all swelling is gone. I'm very, very happy with the results, not only aesthetically, the appearance of the area, but also the feeling. No, that's a great question.
Good. So after a week, was it comfortable to wear pants?
Let's say 10 days.
Okay.
Begin wearing sweatpants or pants without a hard seam.
Something comfortable.
Yes.
Okay.
Yes.
Good. So how long ago was it now that you had your surgery? How far out are you?
8 weeks yesterday.
Okay. So 2 months post-op. How are you feeling now?
Great.
Good.
Great. I have no symptoms. I feel so refreshed and so renewed that I've chosen to have the labiaplasty procedure. It's truly one of the best decisions for me. Most females my age, we grew up watching Oprah. And in the early 2000s, Oprah coined the phrase, living your best life. After the labiaplasty procedure, I feel empowered. I feel truly the most feminine version of myself. And going forward, I truly feel that the labiaplasty procedure is part of my journey in living my best life.
Oh, I'm so happy to hear that.
Yes, absolutely.